11 exercises men over 40 should stop doing immediately. Every day, in gyms around the world, thousands of people are slowly destroying their ligaments and joints without even realizing it. It's that shoulder discomfort you ignore, that twinge in your knee you pretend not to notice. Until one day, a serious injury happens, and there go thousands of dollars on surgeries and therapy, not to mention the time you lose being sidelined, unable to train. In most cases, it all started with a silent little pain that seemed harmless but was ignored. And when that worsens, it turns into a problem you can no longer reverse. The risk is even greater when you're over 40. The body goes through major changes: lower collagen production, reduced joint lubrication, a higher tendency for inflammation, and a harder time recovering. That's why in this video, we'll show you 11 exercises every man over 40 should avoid. And most importantly, I'll present you with other options to work the same muscle groups without putting your joints at risk. Stay tuned until the end, because exercise number 5 is hands down the ultimate champion in causing injuries. And it also happens to be a crowd favorite. Exercise number 11, dumbbell fly. This is a classic chest exercise, usually performed lying on a bench, with arms extended to the sides and bringing the dumbbells to the center of the chest. At first glance, it seems harmless, but the dumbbell fly places significant stress on the shoulder joint, especially at the lowest point of the movement when the arms are open. For those over 40, this extra tension on the shoulders can be a disaster waiting to happen. The rotator cuff tendons, especially the supraspinatus, naturally wear down over time, losing elasticity and strength. Studies like the one published in the American Journal of Sports Medicine indicate that the incidence of rotator cuff injuries increases considerably after 40, mainly due to reduced blood flow in the area and decreased collagen production. And because the dumbbell fly takes the joint to a more extreme angle, it can worsen micro tears or even cause new ruptures. Best substitute: machine fly or cable crossover. With the machine fly, the chest opening and closing movement is guided, meaning you don't have to stabilize your shoulders as much, reducing tendon overload. Meanwhile, the cable crossover allows you to adjust the height and position, working the chest fully, but with better control over the range of motion. In both cases, there is less direct stress on the shoulder ligaments, and you can easily adjust the weight and angle based on your mobility. Exercise 10. Front raise for shoulders. The front raise with dumbbells or a barbell, despite being widely used to target the anterior deltoid, is another exercise that can cause long-term problems, especially when performed incorrectly or with heavy loads. When lifting the arms in front of the body, many people end up compensating with their lower back or hyperextending the shoulder. Additionally, the long head of the biceps and the front shoulder tendons can experience excessive stress. After 40, muscle recovery ability and tendon quality are no longer the same. A small discomfort can develop into chronic tendinitis or an impingement issue in the shoulder. This risk is highlighted in various sports rehabilitation studies, which show that the repetitive front-raising motion overloads both the joint and the rotator cuff, especially when performed above shoulder height. To make matters worse, shoulder injuries take longer to heal than almost any other joint injury. Rotator cuff tears and impingements don't go away overnight. Some require months of rehab, and in severe cases, surgery. Even professional athletes aren't safe. Shoulder injuries have ended dozens of careers in the NFL, NBA, and of course, Olympic weightlifting. Best substitute: military press with dumbbells or machine press. The military press, when performed with dumbbells in front of the body, allows for greater movement control and evenly activates the anterior and middle deltoid, as well as part of the triceps. On the machine, the guided trajectory reduces compensations that could put excessive strain on the lower back and shoulder tendons. Additionally, it becomes easier to adjust the height and stop the movement as soon as you feel any unwanted overload. Exercise 9. Upright row with a barbell. The upright row is often used to target the shoulders and trapezius muscles. The problem is that it can contribute to shoulder impingement. This occurs when the rotator cuff tendons become compressed under the coracoacromial arch at the top of the shoulder. With the arm angle raised too high and close to the ears, the risk of this pinching effect is huge. After 40, any repetitive impingement tends to inflame shoulder tendons and bursae, leading to chronic pain and loss of mobility. Many physical therapists and trainers recommend replacing the upright row with more natural shoulder movements, avoiding lifting the elbows above shoulder level in a tight angle. In short, while the upright row may help develop the trapezius, it can come at a high cost to joint health. Best substitute: shrugs with a barbell or dumbbells and controlled lateral raise variations. Shrugs directly work the trapezius without excessively straining the shoulder joint at a critical angle. Meanwhile, lateral raises, when done carefully, allow you to activate the deltoid without bringing the elbow so high that it causes impingement. By adjusting the weight and range of motion, you keep the workout effective for the traps and shoulders while dramatically reducing the risk of injury. Exercise 8. Leg press machine. The leg press is one of the most popular machines in gyms, especially for those looking to develop their quadriceps and glutes. However, the seated position with the lower back supported can be deceiving. Many people believe this exercise is safer than free squats. When you overload the weight, there's a high chance of straining the lower back and knees. If you fully lock out your knees at the end of the movement, the risk increases even more due to joint hyperextension. After 40, issues like cartilage wear in the knees, osteoarthritis, and reduced tendon flexibility can be worsened by using the leg press with excessive weight or improper form. According to a study published in the Journal of Strength and Conditioning Research, the leg press can significantly increase intradiscal pressure in the lower back when the lumbar spine loses contact with the pad or rounds forward. In other words, any slip in posture can cause damage to the spinal discs. Best substitutes: free barbell squat or dumbbell squat, with strict attention to form. When done correctly, free squats engage more stabilizing muscles and allow for a more natural movement of hip and knee flexion. You have better control over the angle and depth, adapting it to your mobility. Using dumbbells further reduces lower back strain since you don't have to support a bar on your shoulders if that's uncomfortable. This way, you keep your joints more protected while developing leg and core muscles in a more balanced way. Before we move on to number 7, don't forget to subscribe to the channel. In times when misinformation is everywhere, having access to the right knowledge will make all the difference in the long run for those who want to build muscle intelligently and, most importantly, safely. Exercise 7. Behind the neck shoulder press. The behind the neck shoulder press was once very popular, but is now approached with much more caution. Positioning the bar behind the neck forces the shoulders into an extreme degree of external rotation, which can be harmful to the rotator cuff and the acromioclavicular joint, especially if you lack flexibility in the chest and thoracic region. People over 40 tend to experience greater tightness and joint wear, making this movement even riskier. Many fitness professionals report that this exercise is one of the leading causes of impingement issues and even rotator cuff tears, along with abnormal wear on the cervical spine. So if you don't want to jeopardize the health of your shoulders and neck, it's best to avoid this variation. Just as we mentioned in the front raise section, the best substitute is the standard shoulder press performed in front of the body, whether with a barbell or dumbbells. This exercise targets the same muscles without forcing your shoulders into excessive external rotation. Plus, if you feel any discomfort, you can easily adjust the movement path, maintaining a neutral posture and reducing the risk of impingements and cervical strain. Exercise 6. Bent over barbell row. The bent over barbell row is an excellent back exercise, but it's also one of the top movements that can cause lower back issues if you don't have strong core stability and perfect posture control. When you lean forward with the bar, your lumbar discs experience significant pressure, and any rounding of the spine increases that risk. After 40, intervertebral disc degeneration is more common, along with a higher likelihood of bulging discs and hernias. If performed carelessly or with excessive weight, this exercise can quickly make things worse. In some cases, too much load causes people to cheat the movement, using more momentum than actual muscle contraction in the back. This not only strains the lower back, but also increases tension in the hip joint. Best substitute: seated cable row or single-arm dumbbell row. The seated cable row allows you to keep your spine upright, with foot support and full control over the resistance, reducing the risk of lower back strain. Meanwhile, the single-arm dumbbell row, performed with one knee and hand supported on a bench, provides better stability and works each side of the back individually, helping to correct imbalances while keeping the core engaged without overloading the lower back. Exercise 5. Barbell bench press. We've reached exercise number 5, the undisputed champion of gym injuries for many people. The barbell bench press is one of the most popular movements, and for that very reason, one of the riskiest. Not because it's inherently bad, but due to excessive weight loads and poor execution, which are all too common in gyms. Additionally, for men over 40, the stress on the shoulders and wrists can become a serious issue, with the risk of aggravating even the pectoral muscles, potentially leading to tears if the load is too high and technique is poor. A study cited in the British Journal of Sports Medicine found that the bench press is responsible for a significant number of shoulder injuries among weightlifters, mainly due to excessive lower back arching and overly wide elbow positioning, which puts stress on the rotator cuff. If you don't keep your scapula properly stabilized, the risk of shoulder injury increases even further. Best substitute: dumbbell bench press or guided machines. With dumbbells, you have greater freedom of movement, allowing you to adjust the angle of your elbows and hands, which reduces stress on the shoulder tendons while also engaging more stabilizer muscles. On guided machines, you follow a predetermined movement path, decreasing the chances of flaring your elbows too much or excessively arching your lower back. This way, you maintain chest activation, but with much better joint safety. Exercise 4. Traditional sit-ups. Traditional sit-ups, the ones where you place your hands behind your head, may seem harmless. But biomechanics studies show that they can put significant compression on the lower spine and intervertebral discs, especially when done in high volume. The repeated forced flexion of the spine can lead to chronic pain and worsen conditions like herniated or bulging discs, which become more common after 40. Additionally, many people tend to pull on their necks with their hands, creating unnecessary tension in the cervical spine, or perform the movement explosively, using hip momentum rather than properly engaging the abs. This not only reduces the exercise's effectiveness for the core, but also increases the risk of lower back and neck injuries. Best substitute: plank and variations like side plank or Abbey rollout. The plank works the core isometrically, also strengthening the lower back and improving overall trunk stability. The side plank targets the obliques without forcing the spine into repeated flexion. Meanwhile, the AB rollout, when done with proper technique, engages the entire core and requires significant control, but places less strain on the lower back compared to traditional sit-ups, as long as you keep your spine in a neutral position. Exercise 3. Behind the neck lat pull down. Similar to the behind the neck shoulder press, the behind the neck lat pull down also forces the shoulders into an extreme degree of external rotation, which can be harmful, especially if you lack proper flexibility. The head must be pushed forward, creating tension in the cervical spine, and any misalignment can lead to impingements and inflammation in the shoulder tendons. For men over 40, the risk of rotator cuff injuries increases if the behind-the-neck pull-down is performed abruptly or with heavy loads, as there is greater tendon compression when the arm is in external rotation and full abduction. Additionally, the cervical spine suffers because many people tend to push their necks forward or backward to compensate for the movement. Best substitute: front lat pull down or neutral grip pull down. With the front lat pull down, you keep your chest upright and bring the bar down to the upper chest level without excessively forcing your shoulders backward. The grip can be slightly wider or neutral, as long as you don't exceed your shoulder's comfort limit. This variation effectively targets the latissimus dorsi and also engages the biceps, but with a much lower risk of impingement or shoulder strain. Exercise 2. Romanian deadlift. The Romanian deadlift is excellent for targeting the hamstrings and glutes, but it requires strict technique to avoid lower back strain. Unlike the conventional deadlift, the Romanian version keeps the legs less bent and focuses on stretching the hamstrings. However, many people end up rounding their lower back to reach further down or use weights beyond what they can control, increasing the risk of injury. After 40, spinal discs are more susceptible to injuries, and stabilizing muscles may not function as efficiently if not well trained. A slight mistake in spinal alignment during the movement, combined with heavy loads, can be enough to cause chronic pain or even a herniated disc. Additionally, An overly fast eccentric phase can overstretch the hamstring tendons, especially if there's muscle tightness. Best substitute: conventional deadlift or good morning with moderate weight and strict posture. When performed with proper technique, the conventional deadlift distributes the load more evenly between the quadriceps, lower back, glutes, and hamstrings. Meanwhile, the good morning, done with much lighter weight and slow execution, gradually strengthens the posterior chain and improves core stability without requiring the exaggerated range of motion of the Romanian deadlift. In both cases, maintaining a neutral spine and gradually increasing weight is key. Exercise 1. Diamond push-ups. Finally, diamond push-ups, where the hands are placed very close together, are a popular exercise for targeting the triceps. However, they can put excessive strain on the wrists and shoulders while also creating significant stress on the pectoralis minor. If you lack proper mobility, your wrists may suffer from hyperextension, leading to pain and even chronic inflammation. For men over 40, who may already have wrist sensitivity or shoulder issues, performing diamond push-ups with an extremely narrow hand position greatly increases the risk of injury or triceps tendinitis. Overloading the wrist joints is one of the reasons many trainers recommend varying hand placement and avoiding an excessively tight grip during pressing exercises. Best substitute: rope triceps extension. Using the rope attachment on a cable machine allows for fine-tuned adjustments in range of motion and resistance while keeping the wrists in a more neutral position. This significantly reduces stress on the ligaments and tendons in both the shoulders and wrists. This exercise isolates the lateral and long heads of the triceps more effectively without forcing awkward joint angles or compensating with other muscles. Additionally, it's easier to control the weight and execute the movement gradually while maintaining a stable spine and protecting the lower back. This way, you can build strong, well-defined triceps without putting unnecessary pressure on sensitive joints or worn-out cartilage. If you've made it this far, I need to make one important point. Just because you're over 40 doesn't mean doing the exercises in this video will automatically cause injuries. Of course, you can do them. We're simply highlighting that, for some individuals, due to natural joint wear and tear, the injury risks associated with these exercises are higher. That's why we provided alternative movements that reduce those risks. If you enjoy these exercises and have been doing them for a long time without any pain, discomfort, or strain, keep going without any worries. And if you're a man over 40 struggling to see good results in the gym, don't miss our video on the 6 biggest mistakes men over 40 make that stop them from building muscle at this age. It's popping up on the screen right now. Thanks for watching, and may God bless you, my friend.